According to the American Cancer Society, prostate cancer is the second leading cause of cancer death in men in the United States. It is widely recorded that the PSA test may give false positive results, whereby the PSA level may show elevated readings, but no cancer is actually present. False positive PSA tests have shown that out of all biopsies from elevated PSA readings, only 25% of the patients are found to have actual prostate cancer. Transrectal ultrasound, or TRUS, is a guided biopsy and is one of the most frequently used guidance modalities for diagnosing prostate cancer. Although the procedure is performed in a systematic way, it does not function as direct visualization of suspicious lesions. MRI is another widespread technique to detecting prostate cancer non-invasively and is being increasingly used to guide targeted prostate biopsies. Multiparametric MRI with T2W, diffusion or DWI, and dynamic contrast enhanced or DCE sequences is now the established approach to prostate MRI. This technique allows for improved detection, characterization, and staging of focal prostate cancer. Several new approaches are available to directly visualizing prostate cancer, with Doppler ultrasound using elastography are currently under development in order to improve prostate cancer, biopsy accuracy, and yield. Ultrasound elastography, or UE, can reveal stiff lesions that are not visible on traditional TRUS. The main methods for the UE diagnosis of prostate cancer include transrectal real-time tissue elastography and shear wave elastography.
I felt it was better to do something sooner than later and not wait till it got too bad. So after doing the 6 years of the active surveillance, when they told me that the cancer spots did grow a little and there possibly could have been a fourth one, that's when me and my wife decided to discuss it and go over it and think about maybe we should do some type of treatment now. I caught it right away. Hadn't gotten too big. I was able to do only 5 doses of the proton therapy.
Prostate cancer is extraordinarily common as you grow older. So the question is, how deadly is it? But a lot of it is low-grade cancer. The body fights it off, and the body is strong. It counteracts it. Active surveillance. We actually have the technologies now that show what it is, where it is, and how aggressive it is. So in Jim's case, active surveillance allowed us to see there was something abnormal, but it was low grade. So he had time to look around and see what he wanted to do and decide on which one was the best for him at this time in his lifespan.
Yeah, over the years, I've talked to people like just in passing I hadn't seen in a while, and they're like, oh, you hear about so-and-so, he died of prostate cancer. It went to his brain or it went to his lungs. And me having the cancer and then hearing this, I was like, oh my God, is this gonna happen to me? And, going to see Dr. Bard was my best bet because it kept me from worrying, These people let their cancer go. They didn't treat it right away. And I meet people now that say, oh, I'm having trouble urinating, or, I have pressure down there, and they're just scared to go to the doctor because they're scared to know the outcome. And do you want to catch it now when it's treatable, or do you want to wait till it's out of control and then, you got years, months or years to live? And a lot of people are afraid. I think it's the doctors, the way they are with people, that they don't trust them. Yeah, so I'm not a doctor person, and I've gone through 5 urologists through this whole journey, and they don't make you feel comfortable. They're not informative. They're just telling you need to do this. They don't tell you have options. That they make it so you leave there petrified, and I think it's because they want to do surgery on you. It's the only thing I could think of. They want to scare you into doing what they want to do, and most of them want to do surgery right away. That's their first go-to.